So psyche means mind and delos means to show or to reveal. So what we're really talking about is entering into a state of consciousness where there's drugs involved to help or not that reveal more of our minds to ourselves.
Welcome to Season of Stuck, the podcast that takes a deep dive into the all-too-human experience of feeling stuck. I'm your host, Deanna DeBera, and on this podcast, we explore all things stuck. How and why stuckness happens, what it feels like, how to learn and grow from it, and ultimately, how to get unstuck and move forward in an authentic, empowered way. If you are looking for insights, support, and community as you make your journey from stuck to unstuck, you're in the right place. Just a heads up, today's episode is about psychedelic-assisted treatment. So just a reminder that Season of Stuck is for general information only. It should not be considered health, medical, or any other type of professional advice. For more information, you can check out the disclaimer in our show notes. Oh, and this episode also features some very brief adult language. Okay, now on to the show. Gosh, hello. Welcome to Season of Stuck. I am your host. My name is Deanna, and I am just so excited and grateful that you are here because today is like the first official episode of Season of Stuck. I recorded an intro episode which introduced myself and the podcast and what you can expect, but today is like the first official interview episode. I'm stoked. I'm excited. I'm grateful you're here. Thank you for listening. And if you didn't listen to the intro episode, that's totally fine. Let me give you a brief synopsis. This podcast is about stuckness. And I don't know about you, but one of the biggest contributors to my ongoing stuckness is my brain. My brain is like a stuck machine. I ruminate and get caught in self-critical, anxious, and fear-based thought spirals, which is just as fun as it sounds. I get stuck in certain ways of thinking or relating or behaving or reacting, and I definitely get stuck in less than stellar habits. And even though my heart wants to change those habits, my brain just has to make it really, really hard sometimes. And because of the way my brain functions, or malfunctions, depending on how you want to look at it, I'm always researching potential avenues for unstucking my brain, if you will. And one avenue that I find absolutely fascinating is psychedelic-assisted therapy. I first started researching psychedelics back in 2019 when I wrote a story on microdosing as a potential treatment for depression. And since then, I've just been super interested in the therapeutic potential of psychedelics and have taken a bit of a deep dive into the research. Now, it is important to note that the therapeutic use of psychedelics is not a new concept. There are many indigenous cultures that have incorporated psychedelics into medicinal and ceremonial practices for literally thousands of years. So by no means is modern research the origin of using psychedelics medically or therapeutically. But modern research has picked up quite a bit in recent years, so we now have tons of studies that explore the impact of psychedelic-assisted therapy. And honestly, the results are astonishing. So let me nerd out on the research for a second and share a few studies with you. So one study from Johns Hopkins Medicine found that when combined with supportive psychotherapy, 2 doses of psilocybin, which if you don't know is the active compound in what people often refer to as magic mushrooms, produced a rapid and large reduction in depressive symptoms in adults with major depressive disorder, with half the study achieving full remission through their 4-week follow-up. And then a later study found that for some of those participants, the antidepressant effects lasted for up to a year. Research has also found that psilocybin can decrease depression and anxiety symptoms in people living with life-threatening cancer, while also increasing positive markers like quality of life, optimism, life meaning, and death acceptance. And in a study on psilocybin for smoking cessation, which if you've never been a smoker, let me just say, quitting smoking, super hard. I quit smoking 10 years ago, and to this day, still one of the hardest things I've ever done. This study found that nearly 70% of participants reported being smoking abstinent a year after their psilocybin experiences. And in that same study, 86.7% rated those psilocybin experiences as one of the 5 most personally meaningful and spiritually significant experiences of their life. And it's not just psilocybin. For example, there was a recent clinical trial to test the efficacy and safety of MDMA-assisted psychotherapy at UC San Francisco. And researchers found that when paired with psychotherapy sessions, people with moderate to severe PTSD who took MDMA were more than twice as likely to recover from their trauma than participants taking a placebo. And another recent study found that ketamine was more effective than electroconvulsion therapy, commonly known as ECT, which has been considered the gold standard for treatment-resistant depression. And ketamine produced those results without the major side effects associated with ECT, like memory loss. Seriously, those results are insane. But I wanted to learn more about how psychedelic-assisted treatment produces those results. What's going on during those psychedelic-assisted sessions that allows people's brains to get unstuck, whether they're stuck in depression and anxiety, in past trauma, or in harmful habits or behavior patterns, like addiction, which is what today's conversation is all about. Dr. Dave Rabin is a neuroscientist, board-certified psychiatrist, and executive director of the Board of Medicine, a nonprofit that's establishing the first peer-reviewed, evidence-based clinical guidelines for psychedelic medicines like psilocybin, MDMA, and ketamine. He's also a leader in the psychedelic space and one of the few psychedelic experts duly credentialed as an MD and PhD. In addition to his work with psychedelics, he's also the co-founder and chief medical officer at Apollo Neuroscience, the first scientifically validated wearable technology to improve heart rate variability, focus, relaxation, and access to meditative states by delivering gentle vibrations to the body. We talked to Dr. Dave about how the brain can get us stuck and how psychedelics can potentially change the brain and get us unstuck in the process. We also talked about the difference between psychedelic states and psychedelic medicines and how you can actually access a psychedelic state without the use of substances, which is pretty wild. Let's jump into my conversation with Dr. Dave. Welcome to Season of Stuck, Dr. Dave Rabin. How are you?
I'm good. Thanks so much for having me.
Thank you so much for being here. I am so excited to chat with you and dive into what I find to be a very interesting and important topic, particularly in relation to stuckness. So to kick things off, I'd love if you could introduce yourself to the listeners and tell us a little bit about what inspired you to get into psychedelic research and treatment.
Sure. So I'm a board-certified psychiatrist and neuroscientist. I am a translational neuroscientist by training. So my focus has really been in not just bench brain cell research, but actually looking at how to take some of the greatest discoveries of neuroscience that we've had over the last 50, 75, 100 years, and then translate them into real-world applications that we can then use to improve our lives. And in psychiatry, I specialize in addiction and trauma. And of course, helping people get unstuck from trauma, which is a really important topic that has become much more widely understood over the last couple dozen years. And I work very closely with psychedelic-assisted therapy. I'm trained in MDMA and ketamine therapy. And I'm also the chief innovation officer of Apollo Neuroscience, which is one of our tools we developed out of my research into psychedelic medicines to try to make some of the benefits of the safety that we get from powerful, meaningful psychedelic healing experiences and therapy more accessible to everyone.
Amazing. So as a neuroscientist and a brain expert, what is actually happening in our brain when we feel stuck?
It's a good question. I think that the best way to think about it is what happens when our bodies are in a stress response. And when you think about what happens when our bodies are under stress, not just now, but going back 50,000 years to the oldest humans, and even older, we can go even farther back past that to the oldest mammals. So this is a very highly conserved process. And what happens is when we're under stress of any kind, our body shuts down all its recovery systems and all the systems that are responsible for keeping us healthy when we're not stressed, like reproduction, immunity, digestion, empathy, creativity, diverse ways of thinking about complex problems. And it shrinks our window of awareness to what we call fight or flight tunnel vision. And all of our blood and resources go to our heart, our lungs, our motor cortex of our brains, our fear center of our brain to get us out of the threatening situation. And that's not great for problem solving and for emotional identification and emotional processing. That state is a state of, I need to get away from an immediate physical threat, meaning over the course of evolutionary time, predators in the jungle chasing us, lack of food, lack of air, lack of water, lack of shelter. Those are the times when this fight or flight response is supposed to kick on. But now it's getting turned on because we're totally overstimulated. We have too many emails, too much noise, too many responsibilities, too much news. And all of that stuff happening all at once makes us very overwhelmed and induces that same fight or flight stress state that we experienced when we were running from a lion in the jungle. And so we're literally going through modern life, most of us, even though we don't realize it, having the body in a state where it's not able to move things along in process. And when really hard stuff happens to us, like a traumatic event or a very challenging experience of any kind, if we don't have the resources and the time and the space to be able to process what happened and allow it to move forward, then we get stuck. And the stuckness is basically this difference between what's happening in the mind and body, which is our minds might be saying, hey, I really want to move forward from this. I really want to process this. I want to feel better. And then the body's like, well, I'm constantly under stress, so I'm not going to prioritize that. And this difference or divergence between where the mind is and what the mind wants and what we say we want for ourselves and what our state our body's in are not aligned. And so they're not conducive to actually moving things along and processing the experience. So that's what we do with therapy. And if you sum up what all of therapy is really focused on, especially around trauma and PTSD and depression, it's about helping people get unstuck by giving them enough safe space to process and talk about all of the things that they're feeling and all of what's happened to them so that they can start to remake meaning around it and just lubricate the emotional wheels and gears.
So stuckness is like a defense mechanism or a response to overwhelm. When we're overstimulated, we feel like we can't handle all of the things that life is throwing at us. Our body then responds by shutting down, which is when we feel stuck. Even if intellectually we have the desire to move forward, our bodies can't act on that desire because of the disconnect.
Yeah, our bodies. And then there's a physiological response downstream, which is like our bodies are actually resisting the movement because the body's in a fear state and fear paralyzes us, literally. I'm sure you've heard, and many people listening have heard the term like paralyzed with fear. That's a real thing. And that's what happens to a lot of different parts of our bodies that are responsible for creative thinking, that are responsible for helping us figure out how to solve hard problems and get unstuck. Those systems are all powered when we feel safe and when we are recovered and well slept and when we have support around like friends and family. Like all of that becomes easier because the body is physiologically, biologically in a state where process, movement, unstuckness is possible. But when the body is resisting that or in a fear state, that system is paralyzed. And so that's where we try to get people into safe spaces so that they can process all the stuff and get things moving.
So for people who are listening and aren't super familiar, what exactly are psychedelics and what role do they play in interrupting this response that you're talking about?
So psychedelic is a word that was used to describe a state of consciousness. And it's not just in reference to drugs. So there are psychedelic drugs that induce these states, but then there are also natural techniques like deep breathing, meditation, yoga, certain kinds of mindfulness practices, soothing touch, soothing music. Lots of things can induce dreams, right? Dreams are psychedelic states. So there's lots of ways we can experience psychedelic states naturally. But what psychedelic really means is to reveal the mind. So psyche means mind and delos means to show or to reveal. So what we're really talking about is entering into a state of consciousness where there's drugs involved to help or not that reveal more of our minds to ourselves. So the reason why psychedelic medicine and psychedelic therapy and therapy in general are so helpful to getting unstuck and helping to solve and get to the root of trauma is because they give us perspective. Like when you have a psychedelic state, like you're in flow and your mind is quiet and you're able to just witness yourself and observe your thoughts without judgment, even if it's on a run, your ability to gain perspective on what's going on in here, doing this all the time, gets widely expanded. And then once you have access to that state and that information of what's beneath the surface of this rumination, thoughts circling all the time, right, that many of us have, you start to realize, oh, there's all this other information down there that could help me solve this problem. Maybe I have other options I could take other than just circling on this one or two things that I thought I was doomed to re-experience over and over and over again. And that was the only outcome. Maybe that's not. Maybe there's lots of different outcomes that I can achieve here. And so that gain in perspective allows you to see areas that you're stuck. And then when you can start to see, oh, I have all these little blind spots or areas that I was stuck, then you've identified the problem, and then you can start to actually go in and solve it. But if you don't even know that there's a problem and you don't know, you might just feel stuck, but you don't know the areas that you're stuck in, then it can become very hard to navigate and confusing. So psychedelic medicines expand our awareness to, when, especially under guidance with a therapist, to actually see those areas that have been hurt or ashamed or guilty or feeling vulnerable or weak, and then allows those parts that keep us stuck to come to the surface. Then we can talk about it, process it, and start the healing process.
So psychedelics and having a psychedelic experience gives you a broader perspective into what's happening in your mind. As that's happening, what's going on in the brain? What changes are happening that are allowing our perspective to widen, to see those places that we're stuck?
So there's a whole bunch of stuff that's going on in the brain. I can't tell you we know even half of what's going on, but I think what seems to be happening, from what we can tell, is that there's a network in the brain that is a network. When I say network, I mean it's a bunch of different parts of the brain that are always working, but they're talking to each other in a specific way. And the way that they're talking to each other, we sometimes call the default mode, which is like what our brains are doing at rest, which is thinking about self-protection, self-identity. And those tend to be very important and take a predominance of thought, time, and patterns when we're at rest. And so that self-protection or self-identity piece of the brain is a network that exists in many different parts of the brain, all talking to each other at the same time, including the prefrontal cortex and the parts of our brains involved in decision-making, identity, all these things. And we call it the ego. It's that sense of self, and that sense of self that doesn't want to let the guard down. So what's actually happening in the brain is that this network that is focused on like self-protection feels safe enough to turn off or to turn down. And so those parts of the brain that are still active, but they're talking to each other differently. So it's like a different, I think we've talked about this before, right? It's like when you go skiing, you're skiing down the same run over and over and over again. And every time you ski down that run, you're making the grooves deeper, and it becomes easier to ski down it automatically without really thinking. But you're in training that run, you're building grooves into that run in the mountain, just like we do with our thoughts, like having thoughts about how I'm a shitty person, or I'm not worthy of love, or what's wrong with me, that bad things happen to me. All of those thoughts, the more we have them, the tighter they get ingrained into our brains. And there's more tight networks happening between my sense of self-protection and survival and what's wrong with me, that bad things keep happening to me. Then those become tightly wired together. And so, taking a psychedelic medicine or entering a psychedelic state is like getting to the top of the mountain. And then you have, instead of having the same path that you always took down of the way you think about yourself, now you have 8 feet of powder that just dropped on top of you, and you know where the bottom is and you know where you are, but you have no idea what the previous way you used to get there was, or it's just not obvious. And so you have to find a new way. And you can watch yourself do it the old way by just observing yourself, think about yourself the way you used to, and then you have an opportunity to make a choice. And as Robert Frost said, you can choose the road less traveled. You can make your own road. You can take a different path. But we have to recognize and admit to ourselves that there are other paths to take. And sometimes it requires a psychedelic state or a profound perspective shift for someone to actually start to, what we call like widen their window and start to see that there are other paths out there, there are other opportunities.
So psychedelic medicine opens us up to different possibilities. So the connections that are getting formed in your brain, the different ways that your brain is communicating, those give us an opportunity to choose a different path, which then can interrupt habitual ways of thinking, of behaving, of viewing the world.
Exactly. I'll give you a simple example. So you're a little kid and you go into the ice cream store that you've been into a whole bunch of times, which is a fun place for you. And then you go in there and you're like 9 years old and some other kids come up and beat you up in the ice cream store. And now every time you smell ice cream, you smell waffle cones, you think about ice cream, anybody mentions getting ice cream, your body immediately jumps into a fear response. And so you start to get really distressed and feel uncomfortable because naturally you're feeling differently than you were before the ice cream attack. And then you go and tell somebody about it. And you're like, hey, I feel really bad about this thing that happened to me. And then that person says, you know what, suck it up. Or says something like, what did you do that got you into that situation? You must have deserved it. And so now, and this happens all the time, especially with women who have had sexual trauma. And so now imagine in your brain, not only have you just associated tight neural networks between ice cream and potential danger, and the smell and feeling and everything around ice cream shop that is now tightly wired to potential danger, you've also now associated that with another thing, which is there's something wrong with me that this happened to me because I didn't get the support afterwards that I needed. So there must be something, I deserve this. I might be a victim. And then you can start to adopt this victim mindset where you start to think, oh, well, I don't have control of my life because I can't keep myself safe and all these things just happen to me. So bad things just happen to me. And then you start to sort of think about yourself that way. And that's just increasing the tightness of the neural networks around this distorted view of self-identity, which is not true. You just had a really bad experience in an ice cream store. So then when you introduce psychedelic medicines, whether it's like ketamine or MDMA therapy, with the therapy as the foundation, what we do is we help the therapy and the medicine together help people feel safe enough to go back and in little bits and pieces start to re-experience parts of these traumatic memories, but from a safe perspective, not from a horrible, frightening, terrible perspective, from a safe perspective where they know they're not under threat right now. And when they go back and have some of those recollections, what people find is they realize that it's actually not their fault and that it doesn't mean anything about them that this happened to them. And that was in a misinterpretation, simply put, of the situation that happened and it wasn't personal. And they didn't do anything wrong that got them into that situation. It was just what happened. And it's an experience that everybody learned from. And now I'm grateful to be alive. I'm still grateful that I'm alive and I coped with it and all is actually okay. And there's nothing wrong with me. Then there's this process of retraining your brain to know that there's nothing actually wrong with you and that you're retraining thought loops and retraining these connections that we were taught to make around something being wrong with us, that this bad stuff happened to us. So that's what psychedelic medicines really amplify in terms of that's what the repair is happening in the brain, is the remaking of these networks around healthy, positive, safe references to self, where there's nothing wrong with us, that stuff happens to us, stuff just happens to everybody. And then I now know that I can interpret this from a perspective of safety, and I'm not going to let it control the rest of my life and prevent me from enjoying ice cream forever. Does that make sense?
Absolutely makes sense. And that's incredibly powerful. It sounds like the aim of psychedelic medicine, like you said, is to zoom out and deconstruct all of the stories associated with these things and the neural connections so that we don't feel triggered by things and we can approach them from a sense of safety and not be beholden to our trauma for the rest of our lives.
Exactly. And if we don't deal with the trauma, then the trauma can keep us stuck there forever, for our entire lives. And we can even potentially pass it on to our children unwittingly. So it's really, really important for everybody to know that we can heal and recover from this stuff, and that regular old talk therapy without psychedelics is also what does the same thing. It's all working in the same pathways, right? It's all retraining the brain and giving you perspective. The only difference is that some people have been so stuck for so long that we really benefit from integrating psychedelic medicine into the treatment plan because it accelerates the process. But general talk therapy should not be underestimated. Like, that is exactly what the purpose of it is to retrain these thought patterns and give us perspective and make sure we're not thinking about ourselves in a distorted way that isn't actually true. So that's how the simple way of thinking about how it all works.
There are so many different ways to go from stuck to unstuck. But one of the most productive, learning. Learning something new can help you expand your skill set and find new interest, and in the process, help you get unstuck. And if you want to learn something new, you will definitely want to check out Skillshare. Skillshare is an online learning community that offers thousands of classes designed to help you learn, grow, and tap into your creativity, all of which can help you make the journey from stuck to unstuck. And right now, Skillshare is offering a free month to new members. If you want to access Skillshare's entire library of classes and get the education and instruction you need to shake off the stuckness, just visit seasonofstuck.com/Skillshare and sign up for your free trial today. Again, that's seasonofstuck.com/Skillshare. So clearly right now we are in a time when psychedelic medicine and psychedelic treatment is being explored in a kind of deeper and more widespread way. So as a person who is working in this field and kind of in the trenches of what's happening with psychedelic therapy, what psychedelic medicines are currently being used for therapeutic purposes? How are they being used, and what does that treatment look like?
So ketamine is the only legal psychedelic available right now. It's an anesthetic agent that's been studied for over 70 years. It was originally used for pain management and surgical anesthesia, so to help put people under smoothly for surgical procedures. And it was used for also originally to evacuate wounded soldiers from the battlefield so they didn't go into shock, because ketamine has a very rapid action that dissociates people from pain. And what's really interesting that I think we're starting to find out more recently is that emotional and physical pain are actually very similar in the brain. And they need to be treated similar in the brain when we're actually addressing them. And when you think about how a lot of ketamine's like psychological action, we don't know how ketamine exactly works because it has so many different methods of action. But what's interesting about it psychologically is it seems to separate us from our emotional pain and our physical pain in a very interesting way. And it does so for just about 60 minutes. And then you are able to gain perspective, because once you're separated from your pain, which is oftentimes what is contributing to our stuckness, then you can see it without judging it. And you're not overwhelmed by the feeling of it. You can look at it and be like, oh, I'm in pain because XYZ. All these things happened. And then I started doing like thinking about myself differently as a result of XYZ happening. And then you start to have this extraordinary clarity and of awareness of yourself and the way you're doing things, because you can just enter into a state like we talk about in therapy called observer mind, which is just non-judgmentally listening and watching yourself. And so that's what ketamine does. And other psychedelic medicines, people get into similar states with other psychedelic medicines. So they don't all work the same, but they all work similarly from a psychological perspective. When combined with therapy, they amplify the therapy by helping us feel safe enough to go and look underneath the surface. So it's like, imagine you have your most favorite car that you've ever had, and you love this car, and the car isn't running right. All of a sudden, stuff just stops running properly. It's clanking. It's not accelerating properly. And you're like, oh my God, my car, what's going on? But you're afraid to look under the hood because you don't know what you're going to find, and you don't know necessarily what to do about it. And so this is the same thing that's like happening with us when we experience emotional pain about something we care about, and we're afraid to look under the hood. And then, so what do? With your car, you go find an expert mechanic, and you go take your car to the mechanic, and you're like, hey, expert mechanic, I trust you because you specialize in the kind of car I have. Can you help me make my car right, figure out what's going on, and give me a plan, maybe fix it even? And they're like, okay, sure. And we trust these people to do this. We trust these people to go and help us open up the hood and put the car up and do a full inspection evaluation and give us a plan and fix it. And with our mental health, we don't really think about it the same way, but the same thing's happening. And we still need to look under the hood, and we still need to put ourselves up to be able to be inspected and to then go through and come up with a plan and things to do, and then actually do them and fix it. And if we don't, then stuff just sits there, and that's what ends up making us stuck, because we're just sitting there, just letting the problem accumulate and not actually doing anything about it. So if you're afraid to look under the hood of your own self, that's what psychedelic medicines help with. But really in the context of having a good, trusting therapist that you love or that is not judging you, that you can feel like you can tell them anything about yourself and that it's confidential, it's secure, you're not going to be judged for it. And that relationship is the foundation of having these kinds of powerful psychedelic experiences. And I emphasize that only because without that trusting relationship with your guide, your mechanic, your brain mechanic, or wherever you want to think about it now, without that trusting relationship, you are not going to be able to get the kind of benefits we're talking about out of the psychedelic healing process. The medicine amplifies that trust and safety. So that's really what sets the foundation for healing to even happen in the first place.
I'd love to touch a little more on that. Obviously, there are people throughout history who have used psychedelic medicines in a recreational way, which is very different than what we're talking about here, which is psychedelic medicine with therapy. So, what are the differences between the two, and how and why is psychedelic therapy so powerful versus experimenting with these medicines recreationally?
So I guess I'll say first that all of these experiences can be powerful. It's just, are they powerful in the right direction? And is the power or the benefit that you get from it long lasting? Or is it fleeting and fade away within a couple days? So when we talk about psychedelic assisted therapy, where you have one or ideally two expert trained therapists guiding you through this experience under the hood into your own consciousness, people who have used recreational psychedelics and done the therapy with heavily guided in the therapy, right? We're controlling every part of the experience, the safety, the environment, the physical setting, the soothing ambiance of the room, the sounds, the smells, all of it, we are taking care of for somebody. So you really feel held and cared for in the experience. It's like we're giving you a big therapy hug. That's what psychedelic therapy is. And that's really healing for people. And there are certain people who really need that, who don't get that benefit when they take psychedelic medicines recreationally, because they don't have that structure, that space, that heldness. They don't have that space container to have that safe experience in. And what's really interesting from the psychedelic research is that the studies is when you talk to subjects, one of my favorite things that people say is they say, I didn't believe this was the same drug I took on the street when I took it with therapists. And those people say that who've had these tremendous therapy, psychedelic assisted therapy experiences, taking the same medicine on the street and for recreationally and in the clinic or in the therapy setting, they say 70 to 80% of the effect of the healing, they believe, now having experienced both environments, comes from the therapy, and only 20 to 30% is actually coming from the drug. So that's really, really important to understand. And we can help people understand that by creating these safe spaces for each other more. And I think what the common misunderstanding about recreational use of psychedelics throughout history is that a lot of people made themselves messed up by making mistakes with psychedelics throughout history and using the wrong tools when you in their car and breaking stuff. And that doesn't mean that it happens all the time, but it does happen. And there is risk. And what I think eliminated risk or minimized risk, if you go back far enough, like 10, 20,000 years and more, is that many of these human cultures that were using psychedelic medicines in tribal settings had the structure of a tribal community where everybody was living together, everybody was raising their children together, everybody knew everybody, and there was a safe space that was curated by the community and the tribe. And we don't have that anymore. We don't have that at all in most places. Sure, in some places that still exists a little bit, or in the tribes it still exists, but it doesn't exist for most people in Western culture. Most people in Western culture feel isolated and alone, and they're texting all the time or scrolling on socials to feel connection to other people. So that is an extreme difference of environment between feeling held in a community tribe where you can have plant medicine at very high doses with your friends and family as a coming of age ceremony and have a tremendous life-changing experience where you walk into adulthood with grace, or you treat trauma in a community setting, right? They did that too, or illness, or the Western setting, which we do today, where people are using LSD or whatever random psychedelic on a weekend and taking accidentally too high of a dose and going out to some party where they know half the people and there's a bunch of strange people there that make them feel uncomfortable. That is the complete opposite experience in terms of how much you're being held. So I think there are cultural frameworks for how we can safely explorationally and recreationally use psychedelic medicine, but that is not our culture today. And if we want to get back to that, there are a bunch of really important changes we need to make to bring back the connection and the togetherness. And we're just not quite there yet. Are we working on it? Sure, but we're not quite there yet.
It's the idea of the set and setting and how important it is for the environment and how much the environment actually influences the experience. So being in a therapeutic environment where the intention is healing and creating a safe space for the people going through the experience can then actually influence the experience and make it a more safe and healing journey.
Exactly. Our intention matters. Where we decide, what we decide we want to get out of an experience influences directly what we get out of said experience. That's called human energy. We put out what we want to happen in the world. And if we come into an experience intentionally, meaning I'm choosing to, it could be even simple decisions like I'm choosing to use a fork instead of a spoon because of the kind of food I'm eating. Or I'm going to choose to smoke this cigarette because it gives me attention and helps me focus on a task versus I'm going to smoke the cigarette because I'm stressed out and I can't handle what's going on in my life right now. And I need an escape. Those are two very different intentions. Escape from something that is inescapable, i.e. our lives, versus figuring out a way to engage in our lives more effectively and actually work through it. Like what we do with psychedelic therapy is we use it to engage. We use it not to run from things, but to open ourselves up to engage with things and to engage with life. And a lot of the ways that people use recreational psychedelics or any drugs nowadays is to escape from discomfort. And that is what actually sets us up for addiction and dependence and all of the downstream negative things that happen when we start to try to escape from something that's inescapable. It's a futile task.
Well, and it seems like there are substances and experiences that take us away from ourselves. And then there are substances and experiences that can actually, as you said, help us engage ourselves. And it seems like psychedelic medicine in a therapeutic setting is the latter. It's about bringing people in and helping them engage with themselves on a deeper level.
Yeah, I think the caveat there is there are also certain medicines that can do both and experiences that can do both. The intention matters. It's not just the drug or it's not just the action. For instance, sex is one of the most healing things we can engage in our entire lives as human beings with loved ones and with people who we really, really care about. It's one of the most tremendously powerful biologically, emotionally, mentally healing experiences, spiritual healing experiences we can have as human beings. However, when you take sex and you commodify it and then you take love out of it, then people start to use it as an escape from discomfort and suffering and loneliness. So then it becomes transactional. And what happens when you take something that is supposed to be sacred, connection, bonding, loving, accepting, safe, and you make it transactional, it's no longer safe. All of the other benefits you were getting from it, for the most part, most of them are gone. So the intention matters. And also the behavior around that change that matters. People who often have sex to escape from discomfort end up having what we call sex addiction, or they become sexaholics. And you start to do things in your life that are making decisions around when am I going to have sex next, not how do I healthily fit this practice into my life in a way that makes my life and everybody else around me better. Those are very different ways to approach the behavior. And it's the same with drugs. There are lots of people who use cannabis, for instance, who they use it to escape. They zone out in the TV, their phone, they overeat, they become lazy. We know that these things can happen with cannabis when it's misused and abused. And then there are also people who use cannabis to greatly expand the creative capacity of their minds. And some of the most incredibly creative things that we've seen over the last 50 years in everything from like jazz music to modern music to art, so many things, building, architecture, all these things came from people who were under the influence of the cannabis plant. And yet we still talk about it like a Schedule I drug of abuse that has no healthy use or potential. And this is just incongruent thinking. It's about intention. It's about how we use it. So then that brings up the question that I think is really important, which is, how do we teach people how to use drugs properly? Is abstinence only education what we should be continually teaching people, where it's just don't do it? Or should we be saying, hey, here's your instruction booklet. This is everything we know about drugs. This is how to use them safely. This is the age you should start. This is the age you shouldn't start. Here are some of the things that can happen if you use these wrong. Here's how to use them right. Here's your handbook. Why wouldn't we do that for people? That's what they do in lots of places like Amsterdam and Portugal, at least somewhat. They don't do it that directly, but they do it a little bit. And we just say, just don't do it. And then people mess up.
Yeah. First of all, I couldn't agree with you more. And I think back to the drug education that I had when I was coming up through school, and it was completely abstinence based, but also it was so misleading. Things were presented that cannabis is just as dangerous as heroin. And if you do any of them, you're going to end up dead, right? And then
If you do any of them, you might as well have done all of them.
Exactly. And then that sets people up, because then when they try cannabis and they don't die, then it's like, oh, well, what else were they lying to me about? And I could not agree with you more. I think that education, honest education around substances and how to use them safely, like, you're never going to eradicate the desire to use substances. It's part of humanity. People are curious. People like to alter their consciousness. But what you can do is you can give them the information that they need to do so in a way that is going to, at the best, help them live a broader, more full life, or at the very least, protect them from serious harm.
Exactly. Couldn't agree more.
So going back to this intention piece, because it sounds like the intention piece is so important. I would imagine that many people enter psychedelic-assisted therapy with the intention of getting unstuck. They feel stuck in whatever is happening, whether it's trauma, whether it is behaviors that are no longer serving them, problematic thought patterns. And so they come in with that intention. And when you're working with people like that, who come in stuck with the intention of getting unstuck, what kind of results are you seeing people experience after engaging in psychedelic-assisted therapy?
The results are astounding when it's done properly. What we're seeing from the studies with psilocybin, MDMA assisted therapy, ketamine therapy, when done properly, we see people who have been sick or stuck, as they would call it. Sometimes they use both terms, but we see people who have been sick or stuck for sometimes decades, who have tried everything they could find and nothing had ever helped enough to make a dent. And we see these people actually becoming unstuck. That's like the short of it. It's like people realize that they have made a bunch of meaning around their lives and themselves and their sense of self that is not consistent with their goals. And that's holding them back. It's keeping them in place and not allowing them to move forward. And then they realize that they have the capacity to move forward. And then we give them the tools, because at that point they want to know, right? So they ask us, they're like, what can I do? If they don't already know, they start to ask us and we say, okay, let's come up with some things that you could do. What do you think you could do? Here are some things that might help. Here are some ways to think about it. And then we give them the tools and then they start practicing the tools. And it's really around this idea that is also a common misconception in health, which is that there's no source of healing outside of us, outside of ourselves for us. Healing comes from within each of us. There's no other place that it comes from. Do we have great tools and other people and resources that can help move the healing process along? Absolutely. We also have tons of tools that can make it harder and worse. But the point is that they're just tools. And the tools need to be used thoughtfully to either slow down or speed up the healing process. And if we're not using the tools intentionally, we can actually break the car worse. But the healing is still coming from within us. And this goes back to ancient Eastern practices, ancient Eastern medicine, tribal medicine, Hippocratic origins of Western medicine, all agree that healing comes from within the person seeking to be healed. So what psychedelic medicines are doing when helping somebody feel unstuck is also at the same time reminding that person that they have the capacity and the ability, just by being born human, to heal themselves. That is so important, because part of trauma and part of sickness is forgetting that we have that ability. So that is a lot of what the psychedelic medicine experience is doing when done right. And that's why it's so promising for mental health, because people are not just getting better in the short term, they're getting better long term. Like we see people who have had 3 doses of MDMA and 12 weeks of psychotherapy, over 42 hours of psychotherapy over 12 weeks with 2 therapists and just 3 doses of MDMA, are people who've had 17.6 years of PTSD, treatment resistant, are now more than 50% in remission. no longer experiencing symptoms of PTSD. And 1 year later, with no additional treatment, that number just keeps going up. People keep getting more better without more treatment. So we're teaching people something in the process, and I'm pretty sure we're teaching them is to heal themselves again.
Thank you so much for that reminder. It Society is set up in such a way where I feel like we're constantly being told that we are lacking in some way, that we aren't good enough or worthy enough or attractive enough or whatever the case may be. And so we put our energy outward to find something to fix us, something to patch up this hole that we feel. But really, as you said, that ability to heal is in ourselves. There's nothing missing. We have what we need, and there are tools to help us on that path. But ultimately, at the end of the day, we have what we need inside to move forward and live our most empowered, authentic lives.
Exactly. Yeah. And we're all born with it. Just by being human, we have that ability. That's like number one thing we should be teaching kids when they're young. You have this ability. It's like a superpower. If you neglect it, you don't use it, you don't know it's there, guess what? It's useless. So knowing that we have that power, knowing we have that ability as humans is one of the first places that we start with anybody that we start working with in the clinic to try to make sure that they understand this is where we're coming from. I am not your healer. I am not making you better. I am a resource for you. I'm a guide, but you're doing the work. And that starts some gears turning in people's heads, which is good.
Kind of building off of that. So, as you mentioned earlier in our conversation, currently only ketamine therapy is legal on a wide scale. There are places that have legalized psilocybin therapy, and there is potentially other types of psychedelic assisted treatments on the way. But right now, psychedelic assisted treatment is not accessible to everyone. But as you also mentioned, you don't necessarily need a psychedelic medicine to access a psychedelic space and all of the benefits that come with that. So I'm curious, what are some ways that people listening can tap into this psychedelic experience without using any sort of substance? Just as you said, tapping into their own healing energy.
Yeah, so it's a great question. I love talking about this. I think, and for anybody who is interested, we've been doing a whole half year special on the psychedelic report on Spotify and iTunes, on Apple Podcast about the specific topic of getting there naturally. But I think in short, it's things that calm our bodies, that soothe our bodies, that remind us it's okay, it's safe enough to just relax and take it easy for a minute. And those kinds of things, which can be slow, deep breathing, other kinds of faster breathing techniques can also do it, soothing touch, massage, soothing music, sound baths, singing, chanting, dance, flow states, yoga, all of these natural things that have existed for a very long time are ancient techniques for the most part, sometimes modified by current people, but ancient techniques that get us into these states of widened perspective and what we would otherwise call like psychedelic states, but they're psychedelic states light. And can you get all the way there if you practice enough? Yeah, people who can get all the way there with just breathing, but it takes a really long time to figure that out. And it just takes a lot of effort. And so we really wanted to help make that more accessible to people. And so through my research at the University of Pittsburgh, we developed Apollo, which is what I'm wearing on my chest, that delivers soothing vibration to the body that feels like soothing touch. And it turns out the reason why we did this is because when I was studying MDMA therapy and I got my own MDMA training, it became very clear that we had to figure out how MDMA worked because it's so powerful in terms of its healing impact. And so I went back to the lab and started to look at what is MDMA actually doing in the brain? What is it doing to the safety pathways? What's doing to the fear pathways? What's happening when people are feeling so much better? And why does it last? And as I started to look at that, what became pretty clear was that MDMA is amplifying safety pathways in the brain. And this is why it helps us to feel safe enough to go back and remake meaning around past traumatic events and then to heal from them. So that safety really stood out as critical. And of course, safety between doctor and patient or therapist and patient is foundational. It's the number one most important thing. If you don't feel safe around your doctor or your therapist, find somebody else. That's the number one thing that's most important. And so seeing that theme continuously come up, we just thought, what are the easiest, fastest ways to help people feel safe without drugs and without them doing any work, it's the skin, it's soothing touch, it's a mother holding a baby and rocking it back to sleep or nursing a newborn, it's hugs, it's holding hands. All of these things are the fastest, most rapid, effortless pathways to feel safe in your own body. And so we started to play around with that in the lab and figured out that we could compose low frequency sound waves that you can't really hear, but you can feel, and you can wear them on your body, and you can get the benefit of being in this safe, calm, embodied, like light psychedelic state. Maybe it's like 40% of the way there or 50% of the way there, but it's enough that you can start to feel the benefits. And that's what really matters. And then you start to feel good. And then that's what really matters. And then you start to do things in your life that help you still like continue that feeling of feeling good. And Apollo helps train us to do that. And it's certainly done that for me. And I've worn it almost every day for the last 5 years. So and anybody who has an iPhone can download the Apollo Neuro app and try it now if you're curious.
What a cool piece of tech. And you mentioned the app, but if someone wants to try the actual wearable, where can they find the Apollo?
You can find the Apollo at apolloneuro.com or wearablehugs.com, which is what the kids call it. But if you have an iPhone, I would highly recommend download the app and then try it on your phone. The demo only works for iPhone right now. But so if you don't have an iPhone, you have to go to the Apollo website that I just mentioned. But if you have an iPhone, download the app and try it on your phone, because you'll realize one of the things that's really important about Apollo is it's much more than a wearable. It is a technology that can improve the way we feel through anything that vibrates. And the phone is just one example of something you can take with you. It gives you a taste because it's a vibration that you've never felt come out of your phone before, right? Our phones vibrate all the time, but when you feel this kind of vibration come out of your phone, it's like, oh, wow, this is actually calming me down and it's coming from my phone.
What a cool way to take something that, generally speaking, causes us more anxiety and turning it into a tool to better manage and eradicate anxiety. That's amazing.
Exactly. I feel like there's like a connection thing that happens in people's brains when they're like, oh, wait, my phone can do this?
Mm-hmm. Amazing. I am so excited to try that out. My phone is generally a source of ugh, to me. Like I see it and I start to feel my heartbeat a little bit faster and I see the notifications and it's not my favorite. So reprogramming that association and now looking at my phone as something that I can turn to when I want to calm down or feel soothed feels like such an incredible tool.
Yep. I love it. It has been so helpful personally to me and to my family and friends and my patients. Like to actually create a tool that my patients use and get better with. It's like a dream for a doctor to be able to do something like that. So I couldn't be more excited and humbled to be able to work on a project like this.
And to invent a wearable hug, is there anything better to invent a hug that you can take with you? That's incredible.
So I'm saying more hugs for me.
Dr. Rabin, this has been such an incredible conversation. Here at Season of Stuck, we like to end all of our episodes with a couple of quick questions. So if it's okay with you, I have just a few more questions I'd like to ask.
Sure, let's do it.
Okay, so question 1. Thinking about your ideal future self, like the future Dr. Dave that you are working every day to grow into. If he could travel back in time and talk to the current version of you, what advice do you think he would give you on how to navigate stuckness in this period of your life?
Move more physical movement, even though sometimes life seems like it doesn't afford the time to do it. Movement is the single best way to not feel stuck.
Mm-hmm. It's so simple, but it also is so true. Like if I'm feeling stuck, getting up and shaking or dancing or whatever the case may be, it's like an immediate shift.
Mm-hmm. Going for a walk. Mm-hmm. It's quick.
Okay, now rapid fire. So I'm going to ask you a couple of questions and you just say the first thing that comes to mind. Favorite movie of all time?
The Matrix.
Ooh, good choice.
The first one.
Obviously the first one. Go-to coffee order?
Almond milk cappuccino.
Okay. If you could have any animal in the world as a pet, what animal would it be?
Ooh, that's a good one. I've thought about this so many times, and for some reason, it is not coming up for me what my old self always fantasized about having. I feel like, yeah, it was definitely like a lion or an elephant or something like that. Or both, either really interesting, wise, elephant-like jungle creature or a fierce, wise, predatory jungle creature.
Oh, and how cute would it be if they were like best friends? Those would be such fun pets to have. And then last question, best concert you have ever been to?
Ooh, that's a good one. What is the best concert I've ever been to? One of the best, actually, probably the best concert I've ever been to. There's a couple that tie, but I would say, I don't know if how many people know this musician, but his name's Arturo Sandoval. And he's one of the most famous trumpet players in the world. And he also plays like almost every instrument and sings in one of the widest registers of vocal range that is at anybody in the world. So he does this concert where he performs trumpet mostly, and then with a full band, and then sings and does like his whole register from like the lowest note one of the lowest notes you can possibly sing as a human to one of the highest notes you can possibly sing as a human, and does it all at once, and then plays all these other instruments. And I thought, this guy is like the Renaissance man of musicianship. Like, it was just so impressive to see somebody have so many diverse talents.
And there is something really special and moving about being in the presence of not only someone that talented, but someone who is just truly doing the thing that they were here to do. It's just like such an incredible experience. Well, Dr. Rabin, thank you so much for coming and chatting with me. As I said, this has been such a fantastic conversation. I feel like I learned so much, and I know that our listeners will feel the same. Do you have anything coming up on the horizon? Any fun new projects that you'd like to share?
Oh, there's so much. But yeah, just check out my website, drdave.io, and check me out on socials at Dr. David Rabin on Instagram and Twitter. And we post all of that stuff all the time. And I would love to hear from you. So if you like what you heard, please reach out and say hi.
Amazing. Thanks so much, Dr. Rabin.
Thank you.
That's it for today. A huge thank you to our guests for their incredible insights, and a huge thank you to you, our listeners. We know that there are so many podcasts out there to choose from, and we are just so grateful that you chose ours. If you enjoyed today's episode, consider recommending the podcast to a friend or family member that you think would enjoy it. And to make sure that you never miss an episode, subscribe on Apple Podcasts, Spotify, or wherever it is you get your podcasts. And while you're there, if you loved the show, please consider leaving a 5-star review. It plays such a huge part in getting this podcast out to a wider audience and ultimately supporting more people on their journey from stuck to unstuck. And to keep in touch and access even more stuck-related content, follow us on Instagram at Season of Stuck, and visit our website, seasonofstuck.com, where you can sign up to get episodes delivered directly to your inbox. Thank you again for being here. It is so, so appreciated. Until next time, I'm Deanna DeBera, and you're listening to Season of Stuck.